Admiral Wiaki, you heard me mention in my short opening the impact that we've seen in Alaska as a result of the pandemic. The tribal providers being forced to shut down elective procedures in the clinics, the negative financial consequences, I don't think, can be overstated. It's estimated that third-party collections have dropped by 80% in some states. We recognize that the need is considerable, and you certainly know that. One of the things that really has helped shine a spotlight during this time of COVID-19 is when you're telling people to avoid to follow certain safety protocols, like washing your hands frequently, and you are from a village where you don't have safe drinking water, you don't have running water in your home, you don't have the means really to keep yourself and your family clean. This is very, very, very hard, and it just highlights again how essential adequate sanitation is for our communities. We're seeing not only this play out in our communities, but we know that that other forms of disease also come with lack of safe drinking water, lack of the ability to clean and disinfect. Of the 190 Alaska Native communities, 32 are still not served with in-home water and sewer. Typically, these communities have a washateria where you can go and you can wash your clothes, take a shower, get clean. But in many of these communities, and you know because you have seen them, it is simply inadequate. I was out in Wales this past year. Wales has been working for years now to get their washateria back beyond just one shower. There's no washing machines that work. It's a federal effort to get a washateria in place. And not only a federal effort, it then becomes a media event when that story is not only played in the Anchorage Daily News, but in news publications around the country. So it speaks to the issue that so many rural communities lack access to adequate water. And this comes when you have extraordinarily high construction costs in those communities. IHS has established cost caps per home that, when approached, both decrease the priority of the project in the scoring system and limit the amount of funding available. So my question to you, Admiral, is whether or not IHS would be willing to eliminate or at least to raise the cost caps for projects that provide for the piped water and sewer into these unserved communities. We've got to be figuring out how we can do more to be more responsive to get water and sanitation out.
Thank you, Senator Murkowski. And I join you, having seen Wales and Shishmaref myself, and the dire need for these services. Also in my conversation with President Nez on Navajo Nation, they have a lot of very similar issues with a lack of available water systems. And even before the pandemic, we had identified a need of $2.7 billion across our system of care for sanitation and facilities construction needs. But these problems are now exacerbated as a result of the pandemic and the inability to wash hands, as you say, which is one of the public health measures we need to put in place. With regards to the caps, we do have 3 different tiers in the state of Alaska. As we all know, it costs much more to construct. You have to barge equipment in and supplies, and you have to condense your construction time frame. All of those add to the cost. We are currently collecting actual data to identify whether or not the caps that are currently in place are meeting reality. And we know that we now have some additional flexibilities that have been provided to us. President Trump also put in place an executive order that's enabled us to waive certain regulations and policies that may be impeding our construction projects or other infrastructure projects. So I am definitely open to looking at what flexibilities we may have available to us to make changes and get these built once and for all.
Well, I think it's important, you mentioned the flexibility there and the opportunity to perhaps waive. We've also seen the need for community public health measures in terms of how we deal with community contributions in Indian communities for sanitation projects. So having the IHS again look to waive the non-Indian contribution requirements in the Indian communities is, I think, something that could be helpful. So I would urge you, as you are looking to those authorities that you have, what has recently been laid down in this executive order, but I think we have known that we've had this problem for far too long. When we had Dr. Eastman up to this state just, about 6 weeks or so ago, his eyes were opened, and even though this was not something that was in his bailiwick or jurisdiction, he was starting to think outside the box. How can we work with FEMA to perhaps use emergency funds, because this is an emergency. It has been an emergency for a long, long time. That has been part of the problem and what has stalled us out. So know that we're going to keep working aggressively with you. While it might not be something that we can direct funding to now, I think there are flexibilities that we can look to. And I think also when we see the disparities in so many of our native villages, our native communities, following from this pandemic, there needs to be a greater sense of urgency as to our purpose and how we address it together. So I look forward to doing that with both the agencies here. Thank you, Mr. Chairman.